Welcome back to Insight Indonesia, brought to you by the Jakarta Globe. Today we're talking with Dr. Julius July, who is a staff neurosurgeon at Siloam Hospital in Karawaci. We've been talking about brain tumors, taking a look at the brain, and talking about some of the technologies available. For a lot of us, I think the main thing, the first thing we worry about when we think about brain disease anyway, is stroke.
Yes.
Tell us what a stroke is to start with, and then what you can do about it.
Okay. So stroke is when the brain doesn't get the oxygen, which is doesn't get the blood supply.
Mm-hmm.
That's the main problems. So to make it easy, we need to understand that a whole system of the circulation is, consists of the pump, which is heart, mm-hmm. blood vessel, which is the pipe, and also the blood that circulates mm-hmm. inside, which is the fluid. Okay. So anything happen to the pump mm-hmm. can cause a problem. Mm-hmm. Anything happen to the blood vessels can be a problem. Mm-hmm. And anything that change the consistency, the viscosity of the blood, mm-hmm. whatever inside the blood can cause a problems.
Now, as you said earlier also that a tumor can happen anywhere in the brain.
Yes.
Is that the same for a stroke?
Yes. Yes. So stroke can happen anywhere in the brain. Mm-hmm. Because we know that all the blood supply can supply everywhere. Mm-hmm. Of course, the difference is that it's not happen on the cover of the brain.
Sure.
It's happen on the brain cells.
Sure, sure. Inside.
That's the only the only difference.
Now, how do you treat stroke these days? What are some of the advances there?
Yeah. Stroke actually we can prevent. We take care of the pump, we take care of the blood vessels, we take care of the blood viscosity. Mm-hmm. So if you take care of all these things, I think we can reduce the risk of stroke maybe less than 10%. Mm-hmm. Mm-hmm. Okay. You have a routine check of your heart, of
sure.
course, involved with cardiology
mm-hmm.
and all the underlying disease which is involved with the other specialty. And we can check the brain vessels. We have the tools now.
What
we call MR angio, CT angiography, which is, I think, is affordable.
So you can actually look inside. This
yes.
These are all things at the neuroscience
yes.
center.
Yes. Yes.
So not just treatment, but also prevention and actually taking a look at.
Yes.
I didn't even know you could look at the blood vessels.
Oh yeah, we can do that. I mean, if we check the blood vessels, we know whether there is some abnormality, mm-hmm. which is some of those is congenital, develop, okay, and then we also can see the lumen inside, mm-hmm. whether any plaque, the lipid plaque inside.
And can that be that if you find lipid plaque, this kind of thing inside the brain, can you dissolve that with drugs now?
Not dissolve, but the problem with plaque is if you have a soft plaque, if it's rupture, and then it causes what we call emboli, mm-hmm. The lipid emboli can obstruct all the lumen at the distal part of the vessels. Mm-hmm. But what we also can do is actually we can put a stent sometimes to open up the narrowing of the vessels. Mm. We can do it by what we call endovascular treatment. We put a catheter through the mm-hmm. vessels and go to the brain, and then we insert the stent.
Now, as you talk about these things, they all sound a little scary, to be honest, but also that it tells me that if people are careful, they can actually prevent a lot of really horrible things happening to
yes.
themselves. What is the top sort of advice that you would give to our viewers as if they want to be serious about preventing stroke and taking good care of their brain?
Yeah. So for persons that have no sign and symptom, have no problem at all, mm-hmm. they can have at least once in their life to check the blood vessels. Mm-hmm. We have a CT angio. I myself already checked for myself.
Really?
Yeah. Just to make sure that the blood vessels is okay. Those of things is not changing all the times. Mm-hmm. I mean, you can have once and then another 10 years or mm-hmm. maybe 15 years and then you check it again. Mm-hmm. The other thing that you need to make sure is that the fluid that flow inside the pipe, right, mm-hmm. meets the blood. And then you have the routine check. If you have a good check results, and then you can repeat it every 6 months or maybe a year. But if you have a problem with that, you need to take medications to prevent it, because like high lipid and everything, it's not directly cause a problem, but it will cause a problem maybe another 10 or 15 years later.
So they can go out to Karawaci, to the Neurosciences Center, and get this kind of treatment. Now, Siloam hospitals are not just in Karawaci, obviously. There's one downtown now, the Mokhtar Riyadi Cancer Center, and there's one in Kabanjarak, and there's also a lot of expansion going on in Siloam. Tell us a bit about where else Siloam is moving.
I think the owner, which is Pak James and Pak Mokhtar, I think their vision is very good. They develop a lot of hospital which is in the future will be well equipped, at least for neurosurgical services. We know that neurosurgeries depend on the tools, which is expensive. They're gonna build in every big city. Now we have in Jambi, Balikpapan, Manado, incoming in Makassar, and then Bali, Medan. I think we'll be cover all big city.
I think the idea is to cover the entire country eventually. And what about you? Are you going to stay in Karawaci all the time, or do you move around?
For neurosurgery, we work as a big team group. That's how we control the quality of our care. Of course, at the satellite hospital, like in Manado, if they need expertise, help, in certain case which is difficult, and then we can fly there and to help them.
Okay.
Without additional expenses sometimes not expenses for the patients.
Sure, sure. Now the last question and the last thing I want you to tell our viewers, for people who want to, what do you do? What are your lifestyle choices you need to make to take good care of your brain?
We know that smoking is one of the bad things that gonna make your brain age faster. Okay, people have dementia by getting old brain faster by smoking. As you know, also too much alcohol is not good, and then of course exercise can maintain those things.
So don't smoke, don't drink too much.
Yeah, and balance food.
Get plenty of exercise, which means that really the best medical advice is common sense.
Yes.
We know that stuff isn't good for us. Thank you very much for being with us today, Dr. Julius. You've been watching Insight Indonesia, brought to you by the Jakarta Globe. Take those tips to heart and your brain will be healthy. The show is available for live streaming on beritasatu.tv and beritasatu.com, and we put the shows online at thejakartaglobe.com. Thanks for watching.